afternoon. My name is Jessica Dumas. I'm the chairperson for the Winnipeg Chamber of Commerce and president of Jessica Dumas Coaching and Training. Thanks so much for joining us this afternoon. I'd like to recognize the treaty territory that this webinar is coming to you from, Treaty 1 territory, home of the Ojibwe, Cree, Oji-Cree, Dakota, and Dene nations, and homeland of the Red River Métis. Thank you again for joining us today. So happy to see the number of participants that we have. A few weeks ago, we held a Road to Recovery forum featuring the Premier, a number of ministers, and Dr. Roussin. And from that meeting, we received an overwhelming number of requests to hold a follow-up call with Dr. Roussin to discuss specific issues to the events industry and associated businesses. The Winnipeg and Manitoba Chambers have always done what they like to do is go to work on the needs that you have and make this happen. We want to get some of the answers as best as possible to the pressing issues and concerns and connect them to you and provide the guidance and answers in that area. To highlight the interest of today's event, this is the largest web-based gathering for both of the Chambers' history. We have an excess of 700 participants online this afternoon. On behalf of both chambers, thank you for raising your concerns and for being here with us to be engaged in this discussion. Dr. Roussin, we'd like to say thank you to you again for joining our chambers and the business community. You've done an incredible job of stewarding the public health of our province through this crisis. While no one is putting up the mission accomplished banner just yet, your steady hand and wise counsel have put Manitoba in an enviable position as a leader throughout North America in flattening the curve. Before I turn the microphone over to Dr. Roussin, and I'd love to share some administrative items with you. First, we're going to begin with a few brief remarks from Dr. Roussin, Chief Public Health Officer for the province of Manitoba. And following Dr. Roussin's remarks, Loren Remillard and Chuck Davidson, presidents of the Winnipeg and Manitoba Chambers, will moderate the Q&A portion. As you might expect, we've had a huge volume of questions from businesses throughout Manitoba leading up to this event, and both chambers staff had consulted with various industry leaders before this event to consolidate some of those questions that we're going to discuss here today. We'll do our best to get to as many questions as possible, but again, we're going to be starting with the questions that the industry has identified with the pressing ones and the ones that are affecting the most number of organizations. I'll conclude this meeting with final remarks from myself and from our honored guests. And now, Dr. Roussin, the audience is yours. Please take over the microphone.
Okay. Hi. Hopefully everyone can hear me fine. So just want to say thanks for having me back. You know, I think that Manitobans have put us in a great place to be able to be moving forward with our reopening strategy. You've probably all seen the phase 3 document, which is again a further reopening of the economy. Our numbers have looked good for quite some time. We see that our positive test rate in the last 7 days is about 0.1% compared to all of Canada. The average is about 5%. And so Manitobans have put us in this place to continue to open up our economy. So you'll see in phase 3 that we expand group sizes. We continue to loosen restrictions on many businesses, but it's still, we are not certainly done with this virus. This virus is still here. We continue to report cases. We'll continue to see cases. And if those cases end up being in a crowded place for a prolonged period of time, we're going to see or could see a super spreader event. And so really that's the entire purpose beyond still having some restrictions in. But certainly we're in a position to continue to loosen them going forward. With businesses have done an amazing job at getting things back and running while still protecting Manitobans. We're going to still rely on businesses to do that. Certainly public health realizes that we don't know every industry or every sector well, so we can give high level guidance. The details of that will often have to be implemented by the people who know the businesses best. But it really comes down to the basics, that this virus is spread almost predominantly by those who have symptoms of respiratory illness, and it's spread almost predominantly by close, prolonged contact. And so all of our guidance really revolves around those things, that if we keep people who are showing symptoms of illness away from work, away from sitting out in the public, we're going to dramatically decrease the transmission of this virus. If we find ways to limit close, prolonged indoor contact, we're also going to dramatically reduce the amount that this virus can transmit. And so that's the overall guidance that you'll see in every sector that needs to be tailored to meet those sectors. So once again, thanks for having me. Thanks for all your work to this point, and we're going to continue to rely on you a lot for the well-being of Manitobans going forward. So happy to answer any questions.
Thank you, Dr. Roussin. Echo our chair's comments. Pleased to have you once again join us. Just in terms of some administrative items as well for those participating in the call, please add your comments to the Q&A section. There are a number of questions that Chuck and I are going to be asked as prepared by your sector representatives, but as well there will be an opportunity for us to go to the Q&A section to pose those questions directly to Dr. Roussin, and then we're going to conclude with what we call the lightning round, some questions that we're hoping to just get through with some very quick answers as best we can. Of course, we know with COVID there is no black and white, there is some gray, but we're going to try to get through that as best we can. I will, before I ask my question, just note, Dr. Roussin, we did a survey, the Manitoba Chambers, the Winnipeg Chamber, and Leger Marketing came out on Friday, and what became abundantly clear is this sector and associated businesses were without among the hardest hit by the COVID in terms of the economic impact, and hence why we had up to 700 registrations and a great turnout for the event today. So my first question is going to refer to the proposed phase 3. In the proposed phase 3, restaurants can operate at 75% capacity, while other venues such as hotels, convention centers, and event halls are regulated to only operate at 30% capacity. Can you explain the reasoning behind this difference?
Mm-hmm. And so a lot of this goes towards the nature of that spread, that close, prolonged contact. So when we look at places like faith-based organizations, conventions, those type of things, we're going to have the same people in the room for a prolonged period of time. When we look at, say, malls and somewhat to restaurants, it's not necessarily the same people, prolonged exposure all at the same time. So there is some difference in that. Certainly in restaurants, we do have seen super spreader events. So we do need to be careful in that sector. But for the most part, when we see these prolonged enclosed exposures like conventions, like faith-based organizations, that's where we see the biggest super spreader event numbers, and that's why we have a bit tighter of a restriction at this point.
Dr. Roussin, then the next area, and I'm curious just in regards to, because we see different approaches with different provincial governments, and I give the example that in British Columbia, they've expressed that restrictions won't be lifted for mass gatherings and travel until there's a vaccine and community immunity or successful treatments. And I'm just curious if Manitoba shares the same approach, and could we look at something similar here in our province?
Yeah, so it depends on how they describe the mass gatherings. That could be some difference in what we describe as the mass gatherings. I don't think we would paint ourselves in a corner and say there's just no way we can do that unless we get a vaccine. I think we'll just continue to look at what we're seeing. If we're seeing this virus transmitted here, what it's looking like in other provinces, other countries. But it is unlikely that we're going to see mass gatherings in the tens of thousands or anything in the near future.
Just as a follow-up then, is it up to each of the provincial health authorities to sort of make their own determination? So there's not necessarily a consistency amongst every province in terms of what their rules and protocols look like then, is there?
That's right. Yeah. So we meet at the Special Advisory Committee. So all the chief medical officer of health meet regularly to discuss our plans. But many of the provinces look different, and so a lot of our strategies have been different.
Thank you, Dr. Roussin. I'm going to, two-part question. One refers to your first answer to the question I posed. You'd mentioned super spreader events. It's the first time I've heard the reference. Can you just quickly describe what you mean by that, and then I'll pose my...
Right, yeah. Yeah, so we see these super spreader events, which are important in the transmission of these type of viruses. So most of our cases we see here will have the case, and then a couple of their household contacts might be affected. But if we look in other jurisdictions that have high numbers, we'll see a case that, say, was in a restaurant, or a case that was in a faith-based organization, and we might have 20 to 30 secondary cases from that. And so that's kind of what we refer to as super spreader. There's no number that we would say above 10 is a super spreader, not necessarily, but those are the events that really will reverse our success quite quickly if we get ourselves finding a few of those.
Okay. So my question is, we've heard, and speaking with our friends at the convention center, there are a number of very large conventions that are anticipated for the fall. Of course, this was pre-COVID. And as you can imagine, having participated in those kind of events, I'm sure in your career, significant amount of planning goes into them, a significant amount of lead time is required. So my question is, do we anticipate mass gatherings resuming in the fall? Do you see an indoor event in September at the RBC Convention Center? How would you see that? Kind of ask you to maybe take a look and say, what is the probability, and what can we do for those kind of large scale conventions to really support them coming into our community?
Yeah, and so we're certainly going to keep looking to see how we can safely allow more and more gathering. What we find is the problem with large groups is the larger the group, the more likely somebody in there has an infection, and the larger the group, the more likely that person could spread to more and more people. And in the larger the group, the much more difficult it is to contact trace for contacts. So there's three aspects of large groups that really make it ideal for COVID to spread. And so where we'll be in the fall, obviously, is a little bit up in the air. The biggest issue is that we know for sure in fall, just like every fall, it's going to be respiratory virus season. And so we're going to see an increase in respiratory viruses. Whether that's going to be COVID or not, we won't know until then, and we can't declare it won't be COVID until really the end of the season, because it could pop up at any time. So I think it's going to be a really challenging to say that we're going to have indoor events that have thousands of people in it. I don't think we're going to be seeing that in the fall this year.
But is it likely to be able to, sorry, Chuck, just in phase 3, you talk about groups within the larger group. Is that something that could be explored for conventions?
Right, absolutely, and so that's the type of things we're trying to figure out, ways of living with this virus, right, and trying to get back to things that we want to do, but still respect that the virus is out there. And cohorting people is one such way. So if we cohort a huge total group of numbers, but if we're cohorting them in the 50s, then we're essentially still sticking with that 50 group.
Thank you.
Dr. Roussin, one of the protocols that you've talked about since day one is the issue of social distancing or physical distancing as well. And I'm just curious as well. I think this is something that the general public has become well understood, has been a key part of how you lessen the impact of the virus spreading. And so when you continue to see this, I think people are getting used to it. Do you see this as almost becoming the norm? And I think heading into the fall, should people simply get used to physical distancing or social distancing is going to be a protocol that's not going away anytime soon?
Yeah, I think that for the foreseeable future, we're going to need to deal with this virus, and that's going to be one of the mechanisms that, limiting the close, prolonged contact with others is a way of decreasing the amount of contacts overall with this. So, I think there's going to be a lot of things that have changed and that are going to not go back to normal. I think of my clinic every year in flu season, there's 20, 30 people coughing in the waiting room, sitting right next to each other. And, I don't think we're ever going to go back to situations like that.
And would this be as well in those situations where you are going to be in that close proximity, the importance of using masks?
I think that the masks are going to generally be more and more important. The real problem with masks is that they aren't without risk, and they need to be used appropriately. So we've all seen the person wearing a mask under their chin that they later pull up. That's probably putting them at increased risk than not having a mask. So if we move to masks, people need to use them appropriately and effectively at all times.
So I don't need to see that person driving in a car all by themselves wearing a mask.
Exactly, yes.
I was sorry about that, Chuck. What are the main differences in criteria for classifying something as a special event, limited to 25 people indoors and 50 people outdoors, and up to 1,000 patrons visiting an attraction? For example, the Assiniboine Zoo can host up to 1,000 zoogoers if following social distance regulations. But does this mean they can host a special event such as Brew in the Zoom with 1,000 people? And just as well, I'll let you answer that one there. I've got a yes, no for you after.
Right, yeah. So the issue with these events are, so it goes back again, close, prolonged contact, and especially indoor is the big one. And so when we look at malls, when we look at the zoo, essentially we're not seeing that close, prolonged contact. It's different patrons. It might be a lot of patrons, but nobody's around each other for a prolonged period of time for close contact. It's just brief encounters walking by people. When we have a event, a wedding, it's very unlikely that social distancing is going to take place. We have prolonged contact for hours, and it's that same cohort of people that are there. So that's where we've seen that term, those super spreader events. We don't see that at malls. We don't see that at outdoor events, and it's because it's usually brief encounters.
And just as a quick yes, no, whether it's indoor groups or outdoor groups, does the number include staff?
So typically, no. So when we talk about that, we're talking about these orders are meant to the public. They don't apply directly to business operations. So for the most part, no. There, some exceptions there is where, say, a restaurant had a performer there, a band performing or something. Those wouldn't be considered staff. That would cut into their occupancy limit.
So just to clarify then, if I'm holding an outdoor event with 100 people and I have 20 staff that are serving, for example, they would not be considered part of the 100.
That's right. We haven't applied that to the staff.
Okay. Thank you.
Dr. Roussin, we've been inundated with questions from specifically wedding industries. And I'm wondering if you can maybe provide a little bit of guidance or clarity just in the issue of dancing. And there's been questions in terms of if I'm holding a wedding and what the difference is between having a dance floor at a wedding or having a dance floor at a Palomino club or a club like that, in terms of what the rules and what the protocols that you're recommending are at this point in time.
Yeah, so certainly in the bars right now, the dance floors are going to remain closed. At a wedding, we're limiting the numbers. It's still a little bit easier to contact trace at a wedding should a case be located to that. But again, our messaging is that close, prolonged contact. So if it's an outdoor wedding, then even better. If we limit areas of that close, prolonged contact, then even better. And so things like dancing, if there's a large group of people on there, obviously they're not going to be physically distancing, and doing it for a prolonged period of time is increasing the risk. And so we've really started shifting our messaging that that we have to live with the virus, that people need to understand the risks involved with it. And certainly, especially if there are people at that party that are increased risk of severe outcomes, really need to be cautious when doing those things.
Thank you, Dr. Roussin. We've had members of the hospitality sector tell us that the move from 50 to 75% for patios is effectively no increase. Given the increase for outdoor events, can you explain why patios were not included?
Yeah, so we've when we're looking at that, we wanted to increase the capacity. that was allowable because we thought it's prudent at this time and safe. And so it was just our move that we were at 50, so we could increase that by another 50% to get to 75. We've received that feedback from that sector, and we're looking at it. We're going to try to see if we can do better because, like I said, in public health, we don't know the operation of every possible sector. That's why we have these consultation periods. We thought that the 75 would be well received, it would work, but we apparently not. So we're going to look at that and see if there's something better we can do for phase 3.
So you anticipate, based on the feedback, that if there's to be a change, it would be as part of the implementation of phase 3?
That's right, yes.
Okay, thank you.
Dr. Roussin, it was just over a week ago, or a little over a week and a half ago, that 15,000 Winnipeggers gathered at the legislature for the Black Lives Matter rally. And I'm curious, in your mind, if the number of COVID-19 cases do not increase over the next couple of weeks, I guess one of the questions that's come from one of our stakeholders is, will those restrictions and regulations on large gatherings be revisited if we've got an example of one where there hasn't been cases as a result of it?
Yeah. So certainly none of these cases are connected to it. The most recent cases, any cases we get, we're certainly looking at any areas that they may have been that could have large contact numbers. And so it's a challenging situation. Certainly from our standpoint in public health, we know that large group sizes are certainly risky for the transmission of the virus. So we don't recommend that. But obviously we're balancing the enforcement of a peaceful protest, with the public health thing. So it's often a balance. So, depending on what we see, we will message that. If we did see a number of large cases of COVID related to that rally, certainly we'd be messaging that and relaying the risk that was involved with it.
Dr. Roussin, I wonder if I can just follow up. We're getting a lot of questions in the Q&A just in regards to what does prolonged contact mean in specifically? Are we talking 5 to 10 minutes? Is half an hour prolonged contact? And I guess what is proximity in your mind in regards to that?
That's right. So what we talk about from the literature is that 2 meters, 6 feet, 2 meters, and 10 minutes. And so that's close prolonged contact. So that's why walking by someone at the grocery store, we're not really that concerned about it. Sitting next to somebody at, say, a faith-based organization for an hour, that's where we see the transmission.
Thank you, Dr. Roussin. I want to echo some great comments, great questions coming in on the Q&A. So it's trying to balance out the two questions. I'm going to read this one verbatim. It spoke to my heart because I am an avid camper. So for all those campers out there, the question is, we operate a campground where we have closed every second site to ensure physical distancing as our sites are side by side. We will be cleaning the electrical and water poles on each site after the guests check out. The question, if there's no one checking into the site within a day or so of a camper checking out, what or is there a safe period of time that we do not have to clean the electrical and water poles after a camper leaves? Is there a safe time period with no renter on the site? Answering those questions would be helpful as it relates to staffing issues.
Right. Yeah. So it's a bit difficult question. For the most part, no, there isn't one that I could just say it's a safe amount of time. They found the virus to live, or not necessarily live, but they've detected the virus on surfaces, sometimes 5-7 days. We don't know necessarily whether that is a viable virus, whether that would be infectious or not. But my advice would be to clean those after each usage. I would say that depending on the just how close these sites are, I think that's exceptional to close every second site. If the groups are more than 2 meters apart, then there probably isn't a need to close every second site there. But I would I'd leave that up to the person operating it.
Dr. Roussin, one of the other questions we've been getting a lot, specifically from wedding planners and event planners, and we've got it from bars as well, it relates to walk-up at bars in terms of what that looks like. That I know I've heard comments that it's to be served at tables. So, and I guess from a wedding planner perspective, you know, would a walk-up bar be something that would be from a wedding perspective be allowed, or would that continue to be something you would rather have people served at an event like that?
Yeah, so you know, when we open bars, we open them you know, a full phase earlier than what we were planning on doing. And so a lot of the guidelines that we were talking about with the common areas of meeting, dance floors, the billiard areas, to eliminate crowding. We message that everyone should be seated, so not standing together in an area where that crowding is. And it's the same thing as a walk-up bar. That's just an area where there's a potential close, prolonged contact. And so sitting is much better. Certainly, it's in the guidance documents, so it's not written in the public health orders. But if at a wedding you were planning on having that walk-up bar option, you should have things in place that physical distancing could be allowed for.
So if I had the markers on the floor like I have when I go to the grocery store that are 6 feet away, that would be something that would potentially be allowable following those rules then?
Right.
Okay.
So Dr. Roussin, you know, some of the events we're talking about, of course, are in the thousands, but so many events that we host in Winnipeg, be it as chambers, be it in the event industry, are really in the hundreds. And so I'm wondering if you could clarify when we might see events in the hundreds. And I guess as an extension of that, other countries, trade shows, marketplaces, and corporate meetings and hotels have been categorized differently with looser restrictions than social gatherings. So given that many of these are in the hundreds as opposed to thousands, would Manitoba consider modifying the guidelines and definitions of social gatherings to exclude corporate meetings and conferences if appropriate public health protocols can be put into place?
Well, we do look at those things, and we're going to try to, you know, you can imagine when we're trying to make these orders and try to fit them to work for every possible industry, it's challenging. So we do look at that. You know, I would say that in Canada, we had a conference, the dental conference that occurred in BC, led to a number of cases, a number of deaths. So certainly these conferences are, events where we've seen super spreading. But yeah, we're going to keep increasing our group sizes as we see as appropriate. So up to 50 indoors now, even larger, up to 300 if you can cohort those. And if the numbers look like they are now, the next phase, we'd look to further increase that. What that number would be exactly, I don't know yet. But we would continue to increase those. So we're going to see bigger and bigger events, but with lots of precautions still.
So maybe I just add, sorry, Chuck, generally how it's gone is it's been a doubling. So 25 to 50, 50 to 100. Is that, without committing you to anything, of course, is that generally the approach that's being looked at, is just a doubling with each phase? Or is it assessed independently of that?
Yeah. I mean, it doesn't certainly have to look that way. It's just sort of when we started these numbers, we went from sort of the 10 to the 25, and then this last time doubled it. And so that's kind of the natural course of it. But I mean, it is somewhat arbitrary, right? Why is it? Why would the next phase be 100 and not 75? We're just looking to see what we can do safely.
Dr. Roussin, a lot of questions in regards to delivery or food service when it comes to weddings and events and where you have caterers in attendance. So I'm just wondering, one of the questions is, what kind of guidance can you offer caterers and venues when serving food to attendees at weddings and events similar to that?
Mm-hmm. Yeah, so I think just the usual precautions, lots of hand hygiene, ensuring nobody there is ill. And it's, I think still likely best to be able to serve at the tables rather than have that buffet style, people getting up and multiple people touching the dishes and things. So that's where we're at right now. I think it's still not a good time to be doing the buffet style serving.
Just as a follow-up then, another wedding question that we had is in regards to photographs. In terms of what, as people get married and have they gather the families for the group photos, questions just in regards to sort of rules and regulations around that? I'm guessing when you talk about that close proximity, most aren't standing around for 10 to 15 minutes in one photo. So I'm assuming that would be allowed as well, as long as there's, not prolonged again, time together.
That's right. So these are brief encounters which could occur within, again, all those big precautions, right? That there's nobody showing up at that wedding coughing, and lots of hand hygiene. But brief encounters for pictures certainly would be allowable.
Dr. Roussin, the focus, of course, has been on the numbers and how we gather. I'm curious if you could speak to the whole notion of social distancing, and as we roll out future phases, will really the social distancing has been at the core of our flattening the curve efforts and our reopening. Do you see changes to that basic core whereby it's going to be, changes to the 6 feet, 2 meters, or is that would be the final piece that would ultimately be eliminated, where you can actually get back to, hugging if you wanted to, for example? Just curious as to what the future of social distancing is.
Yeah, and so I think that when the day we stop talking about physical distancing is that sort of that return to normal, and so that's probably way down the line with it. So I would tell people that certainly there's nothing in our public health orders that say you can't come within 2 meters of somebody else or can't hug people or anything like this, right? It's a matter of public health advice that the more people you come in close, prolonged contact with, the more likely you could acquire this infection, and so people need to understand the risk and accept whatever risk they can, and knowing that the risk that they accept also applies to people who are close to them in their home and things like this. So it is that balance, but we're probably going to be talking about physical distancing for quite some time.
Dr. Roussin, one of the other questions we have, and I know restaurants have obviously been open for a couple of weeks now, but I guess it's going back to the wedding planners. One of the questions is, for seating at a wedding, do we still need to ensure that we seat guests 6 feet apart? And do people need to wear masks at a wedding? And what's the requirement where we can find additional information on food service?
Okay, yeah. So for the seating at restaurants, and I would apply it to weddings too. I wouldn't have, it's just not really possible to have every individual sitting 6 feet from everyone. So certainly tables should be 6 feet apart. And then at the table, we should, it's ideal to have people in the same household there. It's ideal to allow some separation, but certainly it's not going to be 6 feet apart at the same table. Masks, right now, we don't have a strong recommendation for them. Mostly, like I say, is that masks, to be effective, they have to be used properly, and they have to be used properly the entire time, which often doesn't happen. And so, again, the hand hygiene, ensuring nobody is showing up sick, is some of the best things there.
Just as maybe a quick follow-up, Loren, before we get to that, because there's one question as well. Just, are there parameters in regards to having hand sanitizing stations at an event? Are you looking to have a certain station per number of people in a venue, or is there not necessarily a protocol around that?
Yeah, there wouldn't be anything specific like that. I think that planners, people having an event should ensure there's access to hand hygiene. And the best place is as people are walking in to be able to sanitize their hands as they walk in. Is the best situation.
Dr. Roussin, I'm going to ask you a question. I know it's going to be difficult for you to answer, but it kind of encapsulates, I think, a lot of what we're seeing on the Q&A. And so many people are just trying to get a sense as to what the fall may look like. Weddings, events, corporate, and again, couple hundred here, up to 500. I guess if the outlook continues, if Manitoba remains, each phase is going according to plan. Yes, there's some numbers come up, but everything's very manageable from a healthcare system. I'm going to put you on the spot. September rolls around. Is it feasible we're doing a 300 to 400 person luncheon as a Winnipeg Chamber of Commerce in September at the convention center, if everything goes as planned?
Yeah, so I mean, I think it's possible. I think the number that when we first started limiting group sizes, often 250 was the number. So I could certainly see things getting back up to that area. But again, I would say that we're not going to be in a normal place, and so things that don't necessarily have to be done, that can be done in other manner, virtually, these things like this, should still be planning to that because we're never going to be out of the woods. And then when fall comes, there's no doubt we'll for sure be in respiratory virus season, and we won't know whether COVID's part of that until it's all over. So it's going to be a bit of a challenging time in fall.
And just to follow up on that, sorry, Chuck, is the province going to be providing any additional framework with clear protocols for what is a safe gathering? If so, when do you anticipate those resources would be available?
Yeah, shortly. So as we're loosening restrictions, in the past, being heavily restricted didn't require much guidance because it was so restricted just in there. But now, as we're starting to loosen things, we're really trying to work with workplace safety and health, with public health, to try to get some clear guidance for various sectors.
Dr. Roussin, one of the questions as well, in regards to whether you're at restaurants or whether you're attending events, whether or not, in your opinion, is it recommended that service staff wear masks?
Yeah, so again, it's not a strong recommendation at this point. The other aspects are much more important, that no one serving has even a mild illness, that they haven't been directed to self-isolate for any reason. Frequent hand hygiene is important, and limiting their close, prolonged contact or close contact to just brief encounters with people. That's the most important thing. Masks, if used properly, and there's guidance on our website on how to use masks properly, then certainly that's an added benefit. But masks used improperly do carry some risk. So it's vital that they're used properly.
Maybe I'll just do a quick follow-up as well. I know you mentioned earlier in regards to food service that obviously table service is the preferred, and then in trying to keep away from buffets in terms of people coming up. I guess one of the questions that's been raised as well is that if staff handles the plates and food or serving utensils, can you just have, they're asking if buffet at weddings, if staff is handling all of the plates and utensils, if that would be something that would be a little bit more allowable than what would be considered a traditional buffet.
Right, so that's certainly a better situation where the staff is doing all the serving right from there. Certainly we'll need to have that physical distancing as they're doing that, and so certainly an option. But I don't know if the physical distancing component of that makes that much less efficient as well. So
we can't have that lineup of 100 people trying to get their pierogies and things like that. They have to be 6 feet. They need to be 6 feet apart.
Right.
I agree, because there would be 100 people in line for a pierogi. We're going to move now to some of your questions, and we've been incorporating them, of course, into the Q&A. But and this one, I know you've touched on it, so maybe it's a restating of a question, but you've talked about group sizes applying to private events while businesses are allowed to go up to a certain percentage of normal capacity. Is there a limit on this? For example, if the Royal Manitoba Theatre Centre wanted to hold a performance at 50% capacity with appropriate social distancing, would that be allowed? If a ballroom at a hotel, which can normally hold 800 people, could it be used for 400 people instead? Again, the 50%.
Yeah, so in those situations, those would be, events. So they're stuck to the 300 max.
Okay.
So with the 50 cohorts.
Okay, thank you.
Yeah.
Dr. Roussin, one of the questions here in regards to, and I think this just goes kind of to cleanliness around some of these events as you're opening up. Someone's asking the question in regards to how often should washrooms be cleaned if you're holding an event with 10 to 15 to 50 people. Is this something that needs to be done on an hourly basis, every 4 hours? just I guess looking a little direction in regards to that.
Yeah, and you know what? I don't think there's necessarily a right answer to that. The messaging that we've been providing is that it should be increased. So certainly if you're doing it twice a day before, should be more than that on there. So we don't have a prescription for every hour, every 2 hours, but it should just be more often than before.
And I apologize, Chuck, you might have asked this. It sounds familiar, but I'm going to ask it again. Is a tent with a roof and sides open considered inside or outside?
Yeah, for the most part, that we would consider outside. We'd have to, all these orders require some reasonableness, and so they, if it was a tent just with that roof and all the sides were open, we would almost definitely consider that an outdoor event.
Thank you.
Dr. Roussin, I wonder if you can talk a little bit about schools in terms of what you're thinking in the fall in terms of, I notice we're seeing in some other provinces, class sizes, they're trying to restrict them to 15 students per class. I'm just wondering if you're giving any thought or you're getting any feedback at this point in time of what it could potentially look like for schools in the fall.
Mm-hmm. Yeah, so we're working with education right now to come up with some plans. All plans, even from busing, what that's going to look like. And so certainly it's going to look different than before. They have to come up with ways of that physical distancing. Again, strict policies in place that no staff or students are showing up sick. And in just whatever methods that are possible to have that physical distancing. So in some places, there might be a combined learning where some virtual learning is allowed. There might be staggering of classes. There might be ways of just limiting class sizes. So things like assemblies are going to be out. And so it's going to have a varied approach. It might look different in different institutions depending on what they have, but it certainly won't look the same as it did this past September.
Dr. Roussin, with respect to the 50-person cohort groups within the 300 event limit, can you define that a little bit more? What exactly defines a cohort?
Right. So the big, a couple big issues here is that these groups have to be able to enter and exit separately than other cohorts. And they need to be separated in some manner from other cohorts. Doesn't have to be a physical barrier. But they have to be separated in space from those other cohorts, and there can't be any intermingling between the cohorts. And so it's, yeah.
But that doesn't mean that it's like those 50 people have to be from the same organization. It can be, there's mingling between the 50 within that group cohort. The defining criteria is the entrance, egress, and right. Those kind of
and the separation from other cohorts.
Okay, thank you.
Dr. Roussin, one of the things that we're starting to see in the tourism industry, and I've noticed it in regards to airlines, is temperature checks and before boarding a plane. And I'm just wondering as well, and the question was asked in the Q&A section, if you would recommend temperature readings for guests at events or employees at places of work. If that's something we could see in the future. Obviously, if people are ill and you've been instructing them stay home, would this be another measure that you could see to ensure the safety of people at events or employees at a place of business?
Yeah, so temperature checks have not shown to be beneficial. And so they do it in airports and certain places will do it, but it's just never shown to be beneficial. So I wouldn't put much weight on it. The effort is much more than the benefit. A huge percentage of COVID-19 clients don't have a fever. And so we just know that it doesn't do a great job of finding it. So I wouldn't spend too much time on that. I would do having everyone take the online screening tool to look for symptoms, look for high risk things, but I wouldn't put too much effort in temperature screening.
So would you suggest that pre-screening tool if you're planning even if it's a smaller event or a wedding, if you're the wedding planner, if you should be sending that out to all the attendees in advance to make sure that they've gone through that protocol before they agree to come to an event? Would that be a good practice?
Yes, yeah, for sure. So you can send them a link to the form. It's on our website. and advise everyone to take that that survey immediately before coming. And if they score on it, then they shouldn't attend.
Dr. Roussin, your answer on cohorts prompted a few more questions. One specifically on, does each cohort require their own washroom as well?
So it's a good question. So what happens is that they don't necessarily require their own washroom, but they can't be. There has to be a process in place if they don't have it, that they're not intermingling with other cohorts.
So like table 5, it's your turn to go to the bathroom now.
Sure. Yeah. If you don't have more than one washroom or a washroom for each, then they'll have to come up with some way to ensure that those groups aren't intermingling.
As opposed to drawing to who gets to go to the buffet table first, that draw could become even more important.
Dr. Roussin, one of the questions that we've got in regards to, that comes from the artist group, mobile makeup and hair artists going to people's homes and hotel rooms, should they be following the same salon protocols as they are in a salon as they would if they're going to someone's home?
Yeah, so I think again, this is an area where you could have that close prolonged contact. So I would say that certainly both parties should be taking that online screening tool. They can certainly consider the use of a mask, the hand hygiene, and you know, I guess within a hair salon, you have to be concerned about crowding in the waiting room, which you're not really going to see in these circumstances. But physical distancing when all possible. Certainly, when you're providing the service, you're not going to be able to do that. And so, just making sure no one's showing symptoms of illness, and then the optional use of masks.
Dr. Roussin, in terms of contact tracing, should event organizers be tracking who is attending and have that information? Is that something that you will require as part of any reopening and additional social or enabling those events?
So it would be more in the guidance, but when people are having you know, events, it is nice to have a list available that we could quickly contact trace should a case be presented there. So it's just one of the things that protects sort of everyone in that place, and so it's a good idea to consider that.
I guess one of the questions, Dr. Roussin, as well, and I'm not sure if this falls under your area or not, but one of the questions is being asked if someone will be enforcing the rules regarding weddings, and just like the Liquor Commission sends someone to venues, will there be someone coming into venues to make sure that they're following all the various protocols from a COVID-19 perspective?
Yeah, there certainly could be. Our public health inspectors could certainly take a look at an event to ensure that it's up to standard. And like we mentioned, most times the public health inspectors don't enforce things. They're just there for guidance and education, and almost all the time things get fixed up once people are provided just with a bit of information.
Dr. Roussin, would you consider it acceptable or reasonable to hold the right for an event host to ask someone who's asymptomatic to leave? I believe that was the question would you consider it acceptable, reasonable to hold the right to ask symptomatic guests to leave the event?
For sure. You know, I think that this is going to be the new normal. I think that, you know, that person at the mall or at an event who's coughing, I think that it's not going to be acceptable to have that going on. And so I think that's the whole purpose of the screening, is that we can't have ill people out in public. And I think it's quite reasonable to enforce that.
Okay, thank you.
One of the questions, Dr. Roussin, that we have just in regards to, and again, I'm not sure if this falls under your area or not, but just the liabilities that a business could face if they host an event attended by someone who ends up being COVID positive. Is there any liability from a business perspective or from an event perspective?
Yeah, so I wouldn't give legal advice on it, but what I would say is that, you know, under the terms of, you know, typically on negligence and what is reasonable, if you know, it was found that somebody did things that were unreasonable or negligent, then I imagine it's possible. But if all measures are taken that are appropriate and something occurs, somebody with mild symptoms that went unnoticed, or they are asymptomatic and happen to spread, it seems unlikely. But yeah, I can't, don't rely on my legal advice though.
Oh, mine neither.
I can offer a legal opinion, but yeah, probably not the best. Simple question, can a restaurant host a wedding at 50% of their capacity?
Yeah, so this is a good question, and the answer is no. An event is still under the event numbers, and the reason why is that what we talked about before, that close, prolonged contact. So if you have a restaurant with their 50% capacity is, say, over the group size limits, those are separate people at different tables. If when you host a wedding, there's going to be intermingling between all sorts of people, so it is different. So for events, the group size limits apply.
Okay, thank you.
Dr. Roussin, one of the questions we have typically, and I'm sure when you're going to weddings, or events, there can be goodies handed out at the events, cakes, donuts, and different things. The question is, do they all need to be individually wrapped?
No, I don't think that's necessary. I think as long as the food handling is under the proper circumstances, lots of hand hygiene and things, I really don't think that you need to go through the individual wrapping of things.
Okay, thank you very much, Dr. Roussin. We're going to proceed to our Q&A lightning round, where Chuck and I will fire off a few questions, ideally with yes or no responses. And I will commence with, is it mandatory for the venue to host, or is it mandatory for the venue or the host to provide PPE to the attendees?
No.
Thank you.
Should venues expect health inspectors at their events to ensure that current regulations are being followed?
So yes, they certainly could come to inspect those.
Practically speaking, could you have 5 chairs at a 72-inch round table as opposed to the usual 10 chairs at a 72-inch table? I'm going to ask you to do a little math now.
Yeah, so I would say yes. At a table, we don't require the 6 feet separation for everyone at the table. It's just between tables. And so our public health guidance is that you should limit your close, prolonged contact with people outside your household there, but it's just guidance.
I think we've answered this one, but are bars permitted at weddings and other events?
Yeah, so again, at the events, I think that if you can ensure physical distancing, then yes, that would be allowed.
Do you anticipate parades and being allowed this year in any capacity?
So outdoor exposure is much less risky. You can see that we have those drive-up regulations where we don't limit the amount of cars out in places. So certainly those type of events could occur. As far as crowds out and about, right now we're still going to be at that 300 level. So we have to be careful about that group size that's not nearer with the car.
What about the opening of northern Manitoba?
So that's something that we're looking at actually for phase 3. We're considering, so certainly with the lifting the travel limitations on Western Canada, all of those people would be treated as Manitobans under the northern restrictions as they see now. But it's possible even as part of phase 3, we might lift those travel restrictions outright.
So I had asked you the question about the tents and the flaps being open, being outdoor. So I guess the natural question is, if the walls on those tents were on, would that be considered an indoor venue?
Yes, I think we would consider that indoors.
Okay.
One of the questions we've been asked as well, just in regards to low numbers, obviously in the Maritimes and the travel in phase 3 between Western Canada and Manitoba and a little bit of Northwest Ontario, there's been some questions in regards to what kind of metrics would you need to see for opening it up for the Maritimes?
Yeah, and it's a good question. You know what? Certainly, the metrics they have now are not concerning to us. The issue here is the Northwest Ontario, the Western provinces, they're contiguous with Manitoba, so we weren't sure how we would necessarily work it to have a gap and then allow travel from other provinces that may have to travel through affected provinces that we have a travel ban on. So for this phase, we just left it at provinces that we felt were safe and contiguous with Manitoba, but we'll look to continue to expand that as we can.
Dr. Roussin, dancing at a wedding, yes or no?
So I would say I wouldn't say a yes or no. I would say that it's the people have to be aware of the risk. So it's certainly allowable, but people need to be aware of the risk of that close, prolonged contact, and need to be aware of those who are at high risk of severe impacts of this. So I would take caution.
Just to follow up, we've got a question as well, just in regards to a little confusion. A group of 12 volunteer people who meet all from different households usually sit around the same table. Do they need to sit 6 feet apart or at different tables?
So no. So the 6 foot rule is between tables. So people at the same table don't need to sit 6 feet apart at that table. But then again, it's within reason. You know, depending on the size of the table, if 12 people would be really crowded at the table, then I'd suggest more than one.
A final question in the lightning round, sweat lodges, are they allowed in phase 3?
So sweat lodge, you know, so I think that would be that would have to stick with the group size limits. And be cautious, right? It is close, prolonged contact.
Thank you, Dr. Roussin. I know we fired a number of questions at you and cannot thank you enough for answering them to the best of your ability. Thank you, Chuck. I'll turn it over to Jessica, our chair at the Winnipeg Chamber.
Thank you, Loren, and thank you, Chuck, for hosting that question session and that lightning round. I think the lightning round was kind of fun. We should try to do that more often. I want to say a special thank you to Dr. Roussin. We really appreciate you taking the time to be with us today. We know that your time is in high demand, and thank you for all of the work that you're doing in helping keeping Manitobans safe and assisting us in doing business the safest way possible throughout this time. I'd like to offer you an opportunity for a final comment before we let you go for the evening.
Yeah, and just again, thanks for having me. I'm really happy to answer questions, and I think the quality of the questions is quite reassuring. It's because Manitobans are taking this seriously, and I know the business community is taking it seriously and don't want to see the spread of this virus. And it's just great to hear the engagement on this, because everyone wants this to work.
Absolutely. Thank you so much, Dr. Roussin, for joining us today. And thank you to everyone for signing on and joining us in this online talk. And thank you again to the Chamber's teams for all of your work. I hope that each of you enjoy the rest of your evening. Thank you.
Thanks.
Thanks, everyone.